Hello and welcome. My name's Jan Rice and I act as a wound nurse consultant now, mostly in aged care. I used to teach at Monash University Wound Foundation of Australia and then La Trobe University at World of Wounds. In 2013, I set up my own business, consulting in a general practice setting for 16 years. And I also work in aged care, which is where I concentrate most of my time now. So when I was asked to do this presentation with regard to Wounds Awareness Week, which is an annual event, I wondered what would I talk about, because I believe that this is trying to reach the public. So the presentation, for those of you who are health professionals, might actually seem a little low-key. But I thought about it and I thought, what do we need to do when we talk about an awareness of wounds? What do we need to do? And so I chose skin. I think we actually all forget how important skin is in keeping us healthy. So I thought I'd add some fun sort of facts in here so that, if you're at a party, should we ever get out of COVID and be able to go and celebrate with people, or if you're actually just chatting to people after you've seen this presentation, you might be able to give them some quite interesting facts about skin. So I'll start with this that talks about, and I did get the little 1 square centimetre there. When I put this into the PowerPoint presentation, my 1 square centimetre was actually much, much bigger. So on your screen, when you're looking at this, it should actually be 1 centimetre by 1 centimetre. So it's a tiny little area. So in this, there are 19 million cells. There are 650 sweat glands in this tiny little section of skin. 20 blood vessels and 1,000 nerve endings. We actually have more nerve endings for heat than we do for cold also. I haven't included that anywhere else in the presentation, but in actual fact, our body does not cope with heat as well as it does with cold. And so we have more sensors there to trigger our body to know when we are getting warm, and therefore the body will go into another mode. So a dynamic organ. Now, we shed an incredible 30 to 40,000 skin cells per minute. In fact, more than 50% of the dust in your house is dead skin cells. I actually have a genetic disorder where I don't have any sweat glands, and I also don't have any sebaceous oil glands. So I have very dry skin, and I'm not letting you know that this is my furniture, but sometimes my furniture does look like this. There's sometimes a snowstorm when I take my clothes off in the evening because of very dry skin. Now, the thinnest skin in your body is on your eyelids. My background is plastic surgery. And we used to do blepharoplasties. That's when people have too much excess skin on their eyelid and they want it removed to make them look younger, or there is actually a medical reason for doing that also. But when the surgeon would take that piece of skin off, they never put sutures in it. They always just held it together with tape. And in 3 days' time, we would take that tape off and the eyelid would be healed. So when you rub your eyes vigorously, you actually are abrading this area, and no wonder your eyes will puff up and the area become red, because it is the thinnest part of the skin in your body and it's extremely sensitive. Now, the palms and the soles of your feet are the thickest, where the skin is thickest. And any area that's requiring extra strength will grow more keratin. So, when you're out in the garden and you're digging, yes, you will get a bunching of keratin on the palms of your hands where that keratin is all bumped up. And that, in theory, is to protect you. Of course, the podiatrist may rub some of that excess keratin off, because when you're walking on a mound of keratin, you're actually putting more pressure internally. And so, regular podiatry to shave down some of that excess keratin that's been caused by shear and friction is important. The skin on your feet is 20 times thicker than elsewhere on your body. It went too far. The skin has anywhere between 2 and 4 million sweat glands, with more than 250,000 on your feet. And these produce approximately 300 mils of sweat a day under normal conditions. This is one of the reasons why we do ask people to wear socks in their footwear, and where possible, to pay that little bit extra of money to purchase leather shoes, leather upper and leather lining. If you do not purchase the leather and they are PVC type, man-made substitute type products for your shoes, you may sweat more in them. And this then encourages an imbalance in the bacteria that you have on your body. The sweat glands are more concentrated on the feet than in any other part of the body. So it is important, apart from when you're wearing sandals, and of course the sweat is then evaporating, that when you're wearing closed-toed footwear, you are wearing socks. I'm quite adamant about that because they're going to absorb some of the sweat. And one of the major problems we have as wound clinicians often is that a patient will come to us with a wound on their foot, and we put beautiful, clean dressings on, and we have to put that foot back into a dirty shoe, the inside of which may have some old exudate or some old blood, all of these things. Whereas if you're wearing socks, you're protecting your feet, you're absorbing the moisture, and of course, if you have a wound there, some of the exudate, should it not be contained in the dressing, will actually be in the sock and not on the inside of your shoe. Now, a lot of people attribute how quickly their skin ages to their genetics, but it turns out that external factors play a huge role in skin aging. Sun exposure can account for more than 90% of premature aging, and other factors such as pollution and smoking can factor into how quickly your skin ages. So we want you to take care of your skin, and when you are going outside, yes, you must wear your blockout or wear protective clothing or both, and obviously try and seek some sort of shade where possible. And that's why many cultures actually do carry a camisole, an umbrella to protect them against the harsh sun that we have in Australia. Clearly, there's lots of information out there on smoking and how that changes in your skin. And we also know that smoking reduces your absorption of vitamin C, and vitamin C is important for good skin, good collagen, and if you have a wound, very important for wound healing. So smoking is a no-no in many, many areas. You'll be told by your health practitioner to slow down and to try to stop smoking. If you're young and you're smoking and you want to maintain beautiful skin, stop smoking now. Now, with regard to the structure of the skin, the epidermis is the outer layer. My grandmother used to always tell me we had 7 layers of skin, and when I did my training, I was taught about 2 layers of skin, the epidermis and the dermis. But in actual fact, the epidermis is divided into 2 sub-layers, and the dermis is divided into 5 sub-layers. So in actual fact, my nana was correct in her language. So the epidermis is the thin outer layer of your skin, and it contains dead cells. It is essentially dead. And this epidermis turns over every 28 days. So we know that the cells from the very lower part here in the screen take about 28 days to migrate up to the top and then to stratify and then to be shed off. Now, that's normal in young people. But the literature does support that the older we get, the slower the cells move just like as we age, we will be slowing down somewhat. And so it is important to realise that wounds will take a little longer to heal in an older person, but it's not to say they won't heal. If you take good care of your skin around the wound, you're going to encourage these cells to keep moving. Remember that wound healing starts often from the sides of the wound, and you want perfect skin around the wound. Now, stress, as we're all under stress right now, stress triggers a high level of cortisol and inflammatory molecules called cytokines that spread throughout the body. And this can lead to a rise in inflammatory markers that trigger matrix metalloproteases, which are enzymes that break down collagen molecules in the skin. So the reality is, yes, stress can cause skin changes and skin wounds. So on the screen, I have a picture of someone who's clearly got, well, now they might even call it that maskitis from wearing a mask for too long. So there are papers now being published on the effects of wearing our masks for a prolonged period of times. And there are recommendations out there for also making sure that you change your mask frequently, you wash your mask frequently, and you don't wear makeup when you're wearing a mask. But also we do know that the young ones under certain stresses will get pimples and folliculitis and all that. So that's what that picture's for. The lower picture of someone's armpit is a condition called hidradenitis suppurativa, HS it's now called. And this is not well known. There's quite a bit of literature out there on it and how to manage it. But definitely within the literature, stress is a key figure. And in my wound clinic, in general practice, when I was running that, I would see several people with this condition. They were generally female. As we know, it affects more females than males, and in their mid-40s. And when I did question them about their stress in their life at that time, most of them were under stress. And the recommendations were to get out into the fresh air. Obviously, we managed the wound itself, and I'm not going into that today. But as they're saying right now, even in COVID, is get out, get some exercise, get in the fresh air. So that was good for them. But I also did suggest that they thought about doing some kind of self-thinking, and some self-healing, surround themselves with nice things. Reduce stress. It's very, very important that you take time for yourself and look after yourself. So what are the functions of the skin? Because I've given you some highlights already as to how important it is. Well, when you look at this, you can see, yes, it does protect us. It protects us against bacteria and viruses and has a pH of 5.5. And so that's why some of the products that you see in a pharmacy will clearly label on it, restores pH. And that's what you want. You want a product that will restore your pH to around 5.5. It does protect us also from excess heat, cold and radiation and any mechanical damage and chemical substances and dehydration. It does regulate our temperature through secretion and evaporation of sweat, through vasodilation and constriction, and also with the adipose tissue, it is insulating to us, and our hairs will stand up on end when we're cold, and that will trap some air in there, just like the clouds do, and therefore keep our temperature more stable. If you have a cloudless night, it's often very chilly out there. If we have a lot of cloud cover, we've trapped some of the heat from the earth in there and it's warmer. With regard to sensation, there are nerve receptors for pain, temperature, touch, pressure and vibration. And that's one of the tests that a podiatrist who's looking at your feet and worried about whether you have any sensation or loss of sensation in your feet might even use a tuning fork to test to see whether you can feel vibration. It's certainly a good test to do. And then lastly, obviously there's metabolism the skin. It eliminates any waste, and it synthesizes the vitamin D and the melanin, which are two things that, as you age, certainly the vitamin D, we're all on that. We must get a sunshine. And of course, you're learning more about the melanin now with regard to protecting your skin against harmful rays of the sun. So skin is a mirror into what is happening inside your body. And I have a colleague, Professor Carolyn Carville, and she made a wonderful statement one day that she felt that what we should be doing is teaching everybody medicine from the skin. You see, we can look at you, just looking at your skin, and we can see whether something is wrong. So here I have two hands, and one hand has a very yellow tinge, and this is not someone of a different ethnicity. This is a Caucasian person with yellow skin. So what's going on here? Well, they could have some liver dysfunction. But when we look at your skin, we can actually see whether you have some heart disease, whether you may even have some diabetes, liver disease, the obesity, nutritional deficiencies. We can see all of that sometimes through skin. So it's very important that we look at skin and we take good care of skin. Bacteria that reside on your skin, and they all live harmoniously together until there is an imbalance. So the imbalance can be caused by many, many factors. This little picture of a person with lots of things going on in her mind. The imbalance can be caused by many things. So, for example, sweating into synthetic shoes will imbalance the number of fungi, and we all have 14 species of fungi living on our feet. So that's normal. If you upset that balance, then you're likely to get tinea, or you're likely to get a wound, and then you're going to need help with that. So what do we need to keep skin healthy? Well, you need to hydrate it. You need to hydrate skin from both the inside, that means drinking plenty of fluids when allowed to. Of course, if you have heart failure, you may be on restricted fluids, but don't go to the maximum that you are allowed to have. We do need hydration in the body. And of course, from the outside, using good quality moisturizers. Now, sorbolene is not considered to be an excellent moisturizer. You do need to put your hand in your pocket and get a few more dollars out and pay for a good quality moisturizer. When you pay for a good quality moisturizer, you'll often find you use less, therefore it lasts longer, and therefore and does a better job, but also then won't be costing you so much. Avoid the strong sun using garments and SPF agents. Get a good night's sleep. There's lots of information out there about the value of a good night's sleep. So I do encourage you to discuss with your doctor if you aren't sleeping well, especially in these tough times. We're not proud anymore. We can say to people, I feel a bit low, I feel a bit depressed. You can go on antidepressants for a short period of time to get over the hump of what is troubling you. Never be afraid to discuss these issues with your doctor. Exercise outdoors, as I said, in fresh air and some sunshine. It is good for you. It's also very good to socially. I will probably take the dog for a walk later on today. Just meeting other dogs, saying hello to people, all masked up, but out there getting some fresh air. And then lastly, reduce the stress as you can. So you may even do some yoga or other things. Music is my stress relief. I love music. So whatever it is that will help you to relax, do that. And certainly eating a healthy diet. So the healthy diet, particularly for the elderly, needs to contain more protein, and it also must contain some fat. So stop having the low-fat milk once you hit the age of 65, 70. You need the fat-containing milk, and that is so you will absorb fat-soluble vitamins. The sad thing about getting old is that we look in the mirror and we can actually see what happens to our skin. And so what you see here is you see how the dermis has lost 80% of its original thickness. You can see the young person to the old person here. We lose 40% less collagen, or we have 40% less collagen. And also putting collagen products on the top of our skin isn't doing any good as we age. So don't get sucked into all those beauty therapies. Keeping the skin soft and hydrated is enough. The sebum and sweat production is reduced. The epidermal layer, so the top layer of the skin, separates much more easily from the dermis. The elastin fibers decrease in number but increase in size, which means the skin does become stiff. There's a decrease in Langerhans cells, which are for your immune system. The skin accounts for 40% of your immune system, and the small blood vessels diminish by 40%. So here's the schematic picture of all that I've said, or some of what I've said, showing you the younger skin and then showing the older skin here and the changes in the structure, etc. You must consider your skin as the brick wall of defense. So when you have a minor wound, the body always works towards repair, but you've got to keep the skin as strong as you possibly can. And a small break like this in the fence is actually going to render the whole of this fence unstable. So it's the same sort of process. Your skin is your brick wall of defense, and you must concentrate on good skin care. If you do happen to get a wound, then the body is going to react to that injury, and that redness and the heat, the swelling and some fluid leakage may be for about 3 to 4 days. So we don't rush to get on antibiotics. We wait and see what your body can do. You should then start to grow new tissue, and the new tissue is red in color. We don't like to see yellow tissue in a wound, and you should be growing that for about 2 to 3 weeks. Then from the edge of the wound, new skin will grow, and that will be another week or so. So then the healed wound goes through the maturing process, and this takes sometimes months to years. So here is an image of a wound that is going on to heal. It's someone who came off their bike and went skidding along on the ground. So it's a simple little abrasion. So you can see it's very, very fresh and very bright red, obviously within half an hour of the injury. And then over around day 2, it started to form a soft scab. And then about day 12, it starts to change its shape. And then finally, at day 30, it got completely healed. So what do we ask anyone with a wound to do? We want you to clean the wound using clean solution, drinkable water, potable water we talk about, or saline, or your wound nurse may use some other special cleansers. Cover the wound with a dressing that won't stick but will absorb some fluid in the early days. Rest the area, including elevation if the wound is on the lower limb, and elevation is the foot higher than the groin. If there are no signs of healing in 1 week, seek medical advice. And if there's no improvement in another week, seek specialist wound care from a trained wound clinician. They are around. We want all elderly people to manage their normal changes in their skin by moisturizing their skin with a good quality moisturizer. This little tool on the screen here is called Easy Reach, and it opens up a bit like a pair of tongs, and down one end is a pad that you can use to take the dead skin off your limb that you can't reach, and down the other end is a pad that you put your moisturizer on so that you can apply the moisturizer to hard to reach areas. Make sure that you remove all the obstacles from walkways, just like when we used to change the house for the little toddlers running around with sharp surfaces, etc. We should be doing that for the elderly. And of course, reduce falls by reducing any rugs on the floor that might slip. Get a good night's sleep and discuss pain issues with your doctor. If you have a wound and it's slow to heal, ask to be referred to a wound specialist or a specialist in wound care. These are the things that you must have. You must have a confirmed diagnosis. So you must have a name for the wound. Calling it a leg ulcer is not a diagnosis. It only tells us where the wound is. All known factors that may affect healing should be dealt with and addressed. So some of those are nutrition, leg swelling, pain, and bacterial load. You should be asking questions. Take good care of skin. If you're a health practitioner and you're watching this, please concentrate on skin care. Don't just concentrate on the wound. Thank you so much for listening. Have a wonderful Wounds Awareness Week. Thank you.